Hello, I'm Dr. Sri Banerjee, and in this segment I'll be going over a data set known as National Ambulatory Medical Care Survey. The wonderful thing is about this data set is that the data is freely available, and this is not often that is the case. And a lot of times what you have to do is pay for the data set a significant amount and be able to retrieve that. From here on out, I'm going to refer to the National Ambulatory Medical Care Survey as NAMCS. Here are the downloaded documentation and data sets, and as you can see, this goes all the way back to 1973. So quite a few years are included within this data set. And this is from the National Center for Health Statistics through the CDC. As you can see, there's actually two data sets that are available here. One of them has an NAMCS. So there's multiple types, and you can go into the documentation to see the variables that you really need for your research questions that you're asking. So let's go into here and take a look. So returning to the original screen, as you can see, there's multiple places that you can go in and retrieve the SPSS file. And both of these data sets have important components to it. So then we can go down the list and take a look at what additional information is available. So I'm just briefly going to go into the NHAMCS, and so the NHCS includes NAMCS, and then NCHS, and then NAMCS with an H on it. And they work with the Center for Medicaid and Medicare Services and promote interoperability. These are very important data sets just to get more information about what this entails. The NAMCS, NHAMCS, is the nation's foremost study of ambulatory medical care in hospital emergency and outpatient departments. This has been conducted annually since 1992, and since 2018 the survey has been collecting data on only emergency department visits. So the outpatient departments are excluded from since 2018. Each year, approximately 500 nationally representative hospitals provide data on a sample of patient visits. Sample data are collected over a 4-week reporting period. These collected data are weighted to produce national estimates, which are widely used by healthcare practitioners, policy analysts, congressional staff, the news media, and many others to improve our knowledge of medical practice patterns. So there's a lot of components to this, and hospitals eligible for participation in NAMCS include those who are non-federal, general, and short-stay hospitals located in the 50 states, District of Columbia, and have a 24-hour emergency department. So there's a lot here. If you want to, you can go through what this entails and more descriptions of this. Some of the supplements are not asked in every single year. For instance, between 2006 and 2010, there was cervical cancer screening supplement, so HPV testing did take place during that time. And then in 2008, the Pandemic Emergency Response Preparedness Supplement was administered. So that concludes this presentation on the dataset NAMCS. I hope this has made some sense. Thank you for listening.